I started the account and I called myself The Honest Vet, again, it wasn't necessarily like to be like, I'm the only one out here who's being honest, or I'm the honest veterinarian. It was just more like, this is my honest truth to you, like the honest information that I'm sharing with you.
Hello, and welcome to the Evolved Vets podcast. I'm your host, Dr. Bethany Weinheimer. Hello, and welcome to the Evolved Vets podcast. I'm your host, Dr. Bethany Weinheimer, and today we are here with my beloved classmate, Dr. Sylvalyn Hammond. So Sylvalyn, I have always admired you. You're brilliant and smart and talented. You've been so organized from the day we met, like back in orientation land at, I guess, like first year of vet school.
Yeah,
and it's always been so fun and inspiring.
12 years ago.
I remember like going into anatomy lab with you and just, you know, how smelly it was and and just how we've always like partnered together to get to the right answer. Several different student organizations, and just have always admired your charisma and excitement for life and for veterinary medicine. That's always really shown. So I'm so happy to have you here on the podcast and to dive a little bit deeper and celebrate your journey from, you know, where we started, beginning of vet school, to where you're at today. So tell us a little bit about your journey.
Well, I just want to say, Bethany, I think it's been almost 9 years since you and I sat in the same room.
Yes.
Was it May 9th of 2018 or something like that? And that's coming up quick. So yeah, no, it is fun to reconnect. And I think a lot of us have stayed, you know, connected to our classmates. And it's really fun to see all the things that everyone's doing and how just different our paths have all been since we all started together. Those, what felt like the longest years of our life. But in hindsight, you know, it's crazy to think that we've been out of school twice as long as we were in school now, but it feels shorter.
It does.
Like, at least to me, it feels shorter. So yeah.
And I love our class was so, vet school is a very challenging experience. You're tested regularly. Your patience, your drive, your commitment, your perseverance, your knowledge, your skills, and honestly, your mental capability.
Oh, 100%.
And, you know, that's all of that is challenging. And I think our class had a very special bond, and we felt very much like a family.
Yeah.
And I don't know that every class had that same connection. And I love that we now get to see everybody diversifying how they show up in veterinary medicine.
Yeah.
And it's a beautiful thing to watch. Yeah. Nine years later almost.
Yeah. It is so interesting to see where life has taken all of us, was 126 of us. And I don't think I've kept track of everybody, but a lot of the students peers, I should say. We're not students anymore. We'll always be students in my mind, but
Exactly.
we are students. We're practicing, we're learning every day. But you know, it's so fun to see where everyone's gone. And I will admit, I completely kind of forgot the original question you asked me.
Just tell us about your journey. Like, how did you get here? And then I'd love to talk a little bit about more about where we're at today and your role as a chief of staff, learning more about the Honest Vet, and just really taking a deep dive into your journey from like veterinarian to mother to balancing those and a leadership role and your own business, because we have a ton of members in the Evolved Vets that really get curious around this idea, or it can feel overwhelming, or
100%
wanting leaders.
Yeah.
And wanting leaders and people to look up to in the same avenue. So I think your story is going to be an amazing one.
Well,
so how did you end up here in Charleston?
You know, it's funny. I just mentioned, I'm like, wow, you know, the vet school felt like the longest 4 years ever. And then you just mentioned all of that's happened. I thought, okay, actually, no, 9 years sounds fitting because I could talk for hours about. But yeah, I mean, you remember in veterinary school, it's so funny. We start school and we think we know what we want to do and we know who we're going to be. And I never would have imagined myself here. I never would have imagined myself the veterinarian who sees snakes. Like,
crazy.
I remember them bringing in that big yellow boa for one of our clinical labs and being like, yeah, I'm not touching that.
I was so scared. Laura was like holding it and I was like, can I stand behind the snake?
Some of our classmates were so into it and I was like, no, I'm never going to be doing that. And it is funny. And I remember even in veterinary school being like, oh, why do we have to learn about these things? I'm never going to see them. And now I realize why we need to, because like we were just saying, it's such a diverse profession. There's so much for us to do. And many of us do jump ship. So if you can remember in school, I wanted to be the cattle veterinarian. I was gung ho. I was in the beef
The bovine
yeah,
club.
I can't even remember, but the bovine club and the small ruminant club and the swine club. And I was like, I'm going to be like this mixed animal rural practitioner. And then we were graduating or getting close to graduation and looking at jobs. And I had all this student debt that I was starting to have minor panic attacks about.
Yeah, I just got the chills thinking about it.
Right? Like we know we're going to have to pay it back. But when you're thinking to yourself, oh my gosh, I'm going to have to start paying that back next year. Geez. And then you're applying to jobs. And my first job offers, I looked at a mixed animal practice and they offered me $65,000, which is not a lot of money at all. And it was like, okay, you'll be on call like these days and every other weekend. It was a beautiful practice in a wonderful area outside of Austin. And then I had some offers from some small animal clinics, which I was honestly, it's interesting how I even ended up applying for them. Going into fourth year, I was actually in the middle of our second rotation. I don't remember how many rotations we did in total. It was like 30 or something. And I was tracking large.
Yeah.
And I was on my second equine rotation, and it was equine soft tissue surgery. And I just had this overwhelming feeling that I was making the wrong choice, which was so bizarre because I had been on this path since childhood. Like I was going to be this large animal vet. Like that was who I was going to be. And it was like this, I don't even know, like I was like outside of my body, like watching myself in this place. And I'm like, this isn't right. Something's wrong. And I like almost had a panic attack. And one of our other classmates, and I don't want to like name drop or bring her in here, but one of our other classmates had kind of switched after her first rotation. And I had this like feeling that I just needed to do the same thing. And we were in the middle of like changing this horse's bandage, and she was trying to like kick the resident on the case, and he was great. He was awesome. But I'm like watching this go down, and I'm thinking, I don't know if this is for me, actually. I've been around horses my whole life. I've been seeing this my whole life. And suddenly I'm like, you know what? Do I want to be kicked at or bulldozed by these cattle or like have poop flying in my face from these pigs? Like, is this really what I want? And I took a couple steps back and no one seemed to notice. And I ran around the corner and I ran to the office. Like ran. Like I just felt like I was in my little green jacket and my jeans and my boots. And I was like, I sat down with, I can't remember her name, but she was so nice. She was kind of like our advisor. Linda? I think so. I think it was Linda. And I sat down with her and I was like, I need help. I have to switch. Like help me. And she was I remember like feeling this panic. Like in my mind, it was like I was being chased by lions, and she was like, doo-doo-doo. Like she was so calm.
She's like,
she's like, this happens all the time. Yeah. And right then and there, I changed from large animal to mixed. And then throughout fourth year, I genuinely enjoyed my rotations in the small animal hospital more than the large animal hospital, which surprised me again, because I thought I knew who I was. Like we always think we know ourselves best, and sometimes we actually don't. I don't know. I found like the cases were so much more in depth at time. There was so much more we could do for a lot of these patients. So when I actually came to apply for jobs, I thought, okay, I'll apply for a bunch of different stuff and we'll just see, like, let the chips fall where they may.
See what happens.
And then again, I'm looking at this starting salary of $65,000 for the mixed animal practice versus the small animal practices were offering me like $85,000 and no on call and like
maybe a weekend every 3 months.
A weekend every 3 weeks or something. Exactly. And I was like, that looks pretty good.
That actually looks like the lifestyle that I want to live.
Yeah. And I thought, okay, and of course I told myself what we always say. It's like, I was like, I'll just do it for a little while.
Yeah.
I'll do it for like 2 or 3 years. I'll get my feet under me. I'll get my loans paid down. And then I can always go back to doing large or mixed or whatever.
It feels less intimidating when you tell yourself that story.
Yes. Yeah. So I went to work for a clinic in Austin. It actually was Thrive Veterinary Clinic when they were still very small. I think this was the 5th Thrive ever, and they were only in Austin. And I was really liking it. It was low cost, high volume, so I got to see a lot and I got to do a lot, right? You know, we are fresh out of school and we're telling people like, oh, okay, your dog's got this foreign body and you really need to go to the ER. And at that time, it was a bit more affordable. I think a foreign body was, maybe $3,000. And I would say, okay, that's probably what you're looking at. And they were like, cool, I've got $500. And I was like, well, I've never done this before, but if you're willing to let me try, I can do it during my lunch break for $500. because then I get to learn.
Of course,
and then, no harm, no foul. Like obviously your dog won't survive without the surgery, but you're probably not going to find anyone else who can do it for $500. And
exactly.
I understand, there are some people who might frown upon that scenario, but in those moments I was really worried. I was scared. I was like, oh my gosh, what if I mess it up? But looking back, even though I had never done it, I truly feel like I was prepared.
Yeah.
Now, right? In the moment you're like, am I prepared? Can I do this? You don't feel as confident. But then I did it and I was like, oh my God, that was actually way less stressful and scary than I thought it was going to be. I think my first foreign body was a dachshund that ate a rock. And it was such a perfect, it was like, you took the x-ray and it was like rock
like,
in dog.
Foreign body.
Yeah, like there was no mistaking it.
Out.
Yeah, and he had only been going on, his symptoms were like 48 hours and I opened him up and I found the loop of intestine with the rock in it and I like pulled it off, packed it out, opened it, cleaned it, closed it, a menta patch, put it back in, flushed everything out and I was like, that
I just
was
did it.
very not eventful.
Yeah.
Oh my gosh. And I was able to save lives for, a low cost and learn at the same time. So it was a really good experience. But I was getting, I guess at times, I did feel unprepared for maybe more emergent scenarios. People don't necessarily know what an emergency is in veterinary medicine, as we're all aware, right? So I would get people who would just like run in, like we're in the middle of appointments and someone just run in and they'd be like, this dog's like having a seizure. And I was like, okay, what do I do? Catheter, midazolam, what do I do? What do I do? And I was only doing, 4 days a week at Thrive, no weekends. And after veterinary school, I felt like I had all the time in the world. So I reached out.
Yeah. I was like, whoa, I need a hobby. I've been studying for, basically since I joined school in kindergarten till, graduating vet school. And then it was all of a sudden like, wow, people have this much time.
Yeah, you're like, crazy. What do I do with myself? And of course, I didn't know what else to do but more work. So I reached out to some local emergency clinics in Austin, and Central Veterinary Texas Specialty and Emergency Hospital reached back out to me. And I was like, hey, I want to get some more emergency experience. I want to get better here. This is where I feel like my weak area is. And I would love to come work for you. And I'll charge you like $40 an hour or something, which is like nothing for what, the hour. And they were just like, yes, come. We need people. Like, we'll pay you whatever. Like, just come. And I was like, okay. And I remember showing up for my first shift. So I'm 6 months out of school. I think I've been actually practicing for 5 months. And I show up and I'm like, I check in. I tell the people at the front, like I walk in and I'm like, hey, like I'm Dr. Hammond. I'm here to help. I'm going to be your relief vet for like 1 day a week. And they're like, yeah, go back there. And I'm like, okay. So I walked to the back and it's like pure chaos because I would pick up usually weekend shifts or like Sundays.
Yeah.
So it was like a Sunday.
The busiest day of the week.
Yeah, it was like a Sunday at like 10 a.m. when they first told me to come. And there's just like people running everywhere. Like there's like a dog coughing up blood and like another dog having seizures and like a black cat screaming. And I'm just like, hello. Hi.
Nice to meet everyone.
Yeah. And they were just like, literally, I will never forget this moment. Another doctor came up to me and she's probably like, early 40s, late 30s. And she was like, you're a vet? Like, she's like confirming because I probably looked, I was like 25 still. And I was like, yes, I'm Dr. Hammond. She's like, oh, good. Okay. That board there, those are all of the rooms that are waiting. Pick a clipboard, go to a room, start. Like, just go somewhere. And I was like, okay. And like, I didn't even clock in. I didn't even know where to put my stuff down yet. They didn't even know how to give me the computer yet because they were so behind. So
they were like, do you have my DEA registration?
Like, they were just like, a body. Yes. Go. And there were like 4 other doctors. And I remember going over to the clipboard and being like, oh my God, I don't know what I'm doing. What am I doing here? Why did I do this? And then I'm looking at all like the complaints and it was like dog bite. And I was like, okay, I can probably help that one. And I like went in there and I ended up seeing the dog by myself because there was no techs to help. And I was like, oh, this is okay. Like we got a couple puncture wounds. I know what to do.
Like,
I know what to do.
Yes,
I know what to do. So that was literally my first experience. So I was doing Thrive full time and then I was doing 1 day a week at the ER and mostly, like I said, weekend shifts. But sometimes if I didn't have anything the next day, like if my next day was an off day, I would do 8 to 6 at Thrive and 7 to 7 at the ER. Yes. 1 day a week.
1 day a week.
But I did get a little burnt out, as you can imagine, because I was like just doing all the things and I was loving it. But it was fast paced. Both places were very fast paced. Like I said, Thrive was affordable, high volume, low cost. So we were seeing a pet every 15 minutes, right? And then at the ER, it's just that's what you do. That's your bread and butter. And I will say, I'm so thankful for vets who just do ER because doing that And I just did it for about 2 years. It did make me realize that I couldn't do ER full time.
Yeah.
You know, and it is an emotional.
It is very emotional.
I mean, in good, there's such high, the highs are so high, but the lows can be so low. And like, there were some nights where I was like, I'm not going back. I can't go back, but I would go back. But I was like, I euthanized like 8 things in like 3 hours. Like, how is that even? I'm like, I'm Dr. Death. I am the Grim Reaper. Like, what is happening?
Sometimes it does feel like that.
And again, you know, that's something else I never imagined I would be doing, was doing ER. But I do believe it made me a better doctor, because then I was able to handle those emergencies that were not recognized as emergencies necessarily to those pet parents. And I mean, I think it's honestly something that if you have an option as a new grad veterinarian, that you should try to get some emergency experience, even if it's not for you. Like I said, it was not for me, but maybe for a little time, because it definitely made me a better doctor. Like, of all the things that I have done, it is probably one of the most helpful, especially early in your career.
I completely agree. When I jumped into emergency right out of vet school, it was learning surgery, learning endoscopy, like understanding these like high volume, very fast pace. Like my uncle, back in the day, he graduated from Texas A&M vet school too. And at the time you could be a live-in like student doctor.
Okay.
And you lived above the ER,
you
were always on call.
Okay.
So he kind of like grew up doing emergency, and he opened his own practice later in the Houston area. But he told me, because he was like, you know, you can come work for me when you're done with vet school if you'd like.
Yeah.
And I told him, hey, like, love you so much, but I actually love emergency medicine.
Yeah.
And he looked at me, he's like, that's the best decision you can ever make. He said, you can always get slower. He's like, but learning how to multitask and juggle, like that skill will be with you throughout your entire career of veterinary medicine. So to your point, even if you try ER and it's not for you, that's okay, because you learned how to multitask. The juggling is picking things up and putting them down and being asked a question. Like that is the skill to know.
And
in ER.
the pace at which you have to think and react. Like I'm a very indecisive person naturally. I'm a Gemini, so we've got that. Yeah, okay.
I also struggle with that
but in those scenarios, you don't have time to sit there and be like, well, we could. You're like, okay, this patient is crashing. Like, I'm gonna do things that I have to do to like make sure that we get out of this situation. And I don't know. It's like a different part of your, like, that part of my brain shuts off in that scenario, and then that's like I step into this other person. And actually at the clinic that I currently work at now, like the first time we had a real emergency come in, I'd been doing some work there for a while, and then somebody ran in, and two of the girls were like running to the back with this dog that was clearly like overheating, and they were like, we have like a heat stroke dog here. And then all of a sudden they're like, oh my God, there's 2. Like, these 2 dogs had been in someone's truck when he was inside somewhere for a meeting. And I guess the truck turned off. Like, he had left it on for the dogs running, but it's summer in Charleston and the truck turned off. And he's like, I was only gone for 30 minutes. Like, oh my gosh. But so he showed up with 2 dogs.
So scary.
One of them's actively seizing. Their temperatures were like so high, but they were like, so anyway, I'm like managing both these dogs and doing all this stuff. And afterwards, the team was like, you were like a robot. Like, who were you? Like, you were a different person. And I'm like,
it's like
you
this
just
like
have
zen
to be. Yeah, like
comes over you.
But it's like, it's a skill that you can't teach. Like, you have to kind of just learn that. And I do think it also helps with confidence in decision making, because you know it. And when you can't sit there and second guess yourself, you just do it. And then you're like, oh man, it's like, I did that. Like, I didn't sit there and second guess, like back to that situation with the foreign body and the rock. Like, I could have been like, oh my gosh, I can't do this. Or what if this goes wrong? Or what if that goes wrong? Or whatever. Like, and I had that feeling, but in an emergency situation, like, you don't have time to let those demons talk you down. Like, you're like, and there are times I probably did make a few wrong calls. Like,
of course.
You're like, afterwards, you get the thing, you're like, oh, I should have done this instead of that first or whatever. But like, in those situations, like, no one's going to ever hold that against you, because all of us do it,
Yeah.
But yeah, I did that. That was like a good 3 years after veterinary school. And it was actually about 2 years into all that I started my Instagram account. And again, doing high volume, low cost, I just got to talk to a lot of people every day. And I was kind of shocked by some of the things that I would hear people say about vaccines or I'll never forget the first time I had my technician come back for like a wellness appointment for for this puppy, and they're like, oh, they're here for, establishing care and like a fecal. And they're like, oh, but they don't want to do like the parvo vaccine. And I was like, what do you mean they don't want to do the parvo vaccine?
Yeah. Like I don't understand.
I was like not computing. Yeah. I was like, what do you mean? Yeah. Like I couldn't figure it out. I was like, is this like a joke? Like, what are we talking about? He's like, no, they're like an anti-vaxxer for their pet. And I was like, no, like what? Like I literally could not. He was like looking at me and he's like, no, like they do not want to do. And I was like, they have to. Like,
that's not an option.
Yes. Like, so I went into this room and I'm trying to, because what I don't want to do is I never want to make someone feel defensive, because then I feel like as soon as you do that, you lose, right? As soon you lose, they take their dog, get up and leave. So like that moment that you have, like knowing their concerns and walking into the room, that is your chance to build a bridge. And you might not vaccinate the dog that day, but at least you can like plant a seed, right? That's the way I look at it. But this is kind of my first scenario. So I'm like, okay, all right. It was almost more stressful than an emergency situation. I was like, how do I get this girl to vaccinate her puppy? And I actually can't even remember in that situation if what ended up happening, if I was able to. I don't think they did vaccinate that day, but I had a really good conversation with them, and I printed out a bunch of stuff for them to go home and read.
Wow.
And, because I care and we care so much. And I followed up with them. I was like, hey, like just checking in, just
did you get your vaccines?
Yeah. Like pretty much, like please come back, essentially. Yes, yeah. And I feel like most of the time when that happens these days, which is becoming more and more common, I am usually able to get people who are vaccine hesitant to vaccinate. Or whether it's heartworm preventative or what spay, neuter, whatever it may be, usually with just a good conversation and having the evidence and the data to support it, but also listening to their concerns. But anyway, I'm 2.5 years out of school. I'm hearing stuff from pet parents regularly that just shocked me. Like raw diets or no heartworm preventative or don't want to do vaccines or
indoor dog doesn't get ticks.
Just yes, yeah. Or you're paid by big pet food companies or you're still for big pharma, like pushing these meds. I mean, just the stuff I would hear. And there was another puppy that was brought to me by a woman who had recently adopted this like doodle thing. It was like a mini little brown, looked like a chicken wing, like a little piece of fried chicken, they're so cute.
Yes, so cute.
But, I'm doing the physical exam on this dog and I'm like, oh, and he, he's got a bit of brown debris in both of his ears. So I am concerned about a yeast infection, and it doesn't mean he's broken or a bad puppy or anything, it's very common because these guys tend to have a lot of extra hair around their ear canal, and puppies will lick their babies all over so they get moisture in there. So this happens, and we can just take a little sample, confirm it, and then treat it. And she's like, well, I need to call the breeder first. And I was like, okay, sure, maybe they've got a contract.
Yeah,
whatever,
maybe they're paying for the vet bill.
Yeah, I don't know. I have no idea. This is the first visit. So she calls her and she's on speakerphone, and the breeder is like, do not let that veterinarian touch his ears. She doesn't know what she's talking about. And I was like, excuse me, I can hear you.
Excuse me.
I
do know what I'm talking about.
There's some debris in his ears. And she's like, well, debris doesn't always mean there's an ear infection. And
that's why we run the test.
Yes. So I'm sitting there trying to, be like, hey, and the woman is clearly like, as the breeder is talking to her, she pulls the dog away from me. And I was just like, I'm losing here. Like, what do I have nothing to do. And she's like, yeah, I'm just going to take her back and she's going to look at it. I'm like, with her microscope? What is she gonna look at? I was like, what? Look at what?
Look at the debris in the ear.
So she ended up doing her wellness appointment and I think a vaccine, but wouldn't let me do. But I just remember that conversation was sitting so poorly with me that I was like, all right, I'm tired of this. I'm tired of being on the back foot. I'm tired of having to basically keep people from jumping off this edge of misinformation all of the time. So really I started with the idea of not convincing these people who are so far down the misinformation rabbit hole, I can say, or they're so convinced that vets are bad, or they're so convinced that it's better to do things a certain way.
They've made their decision.
They've made their decision. There's probably nothing I'm going to say that's going to convince them otherwise, right? But my hope was okay, if I'm putting good information out there or honest information that people feel like they can trust, then hopefully I'll at least prevent people from getting to that stage. We can reach them before they get there.
Let me speak directly to the woman who feels like she's barely holding it all together. You are still competent, You're still high functioning. Your team probably thinks you're fine. Your family probably just thinks you're a little disconnected. But inside, you're exhausted, irritable, disconnected, and wondering if you chose the wrong path. Code Blue Coaching is not about quitting veterinary medicine. You've already invested $250,000 or more in your education, and there's also been time, energy, love, and compassion given to vet med too. This is about reclaiming yourself inside of vet med instead of giving up on it. Over 6 months, I partner with you and hold your hand as we identify patterns keeping you in survival mode. We rewire the perfectionism loop that constantly happens, rebuild your self-trust and your self-worth, create boundaries you can actually hold, and you have your accountability from yours truly. Don't forget, we also get a one-on-one personalized recovery protocol just for you that will help you for years beyond our coaching time together. So what you get is accountability, nervous system tools, and a true hand-holding pattern that will help you through with a white glove experience. And if you've been waiting for permission to choose yourself, now is the time. Make that extra moment to prioritize you so that way you can sustain your career in vet med. Now, if this calls to you or you're curious, go to evolvevets.com where you can learn more and book an alignment call with me so that way we can better discuss if this is the right next step for you. I hope to see you in there and that we can stop this Code Blue moment.
So I started it. I never expected it to be what it's become today. But yeah, so it was in its infancy. I got married 3 years after school, and we, on a whim, moved to Charleston.
What brought y'all here?
Yeah, I wanted to live by the beach just one time.
So
I grew up in the desert in Arizona, and then we were in East Texas. And my husband and he got switched to remote work fully because of COVID.
Yes.
And we were newlyweds, and we were like, do we want to stay here? What do we want to do? Austin was fun, but neither of us were tied to it.
Yeah.
And I was like, I want to live by the beach. I've had family in California. I've been around California. So I thought I want to go the other way. Like I've never lived on the East Coast. So let's go that way. Yeah. So we did a Google search, and Google said that Charleston was a great place to live by the beach. It didn't snow. It was small. And I was like, okay, well, my brother is in Charleston actually for the naval school. There's a naval school in Goose Creek. So we'll go visit my brother and we'll see if we like Charleston. And we came for a weekend and absolutely fell in love. I mean, it's so cute. And so, yeah, we just on a whim, packed up and drove out here. And when I was looking for jobs out here, it was still kind of COVID-y. So there wasn't a ton of places hiring, but there were 2 clinics hiring. And I went and interviewed with both of them and toured the practices. And I just didn't love either of them.
Yeah.
And I didn't want to get stuck in a non-compete situation because Charleston's small.
So small.
It's big and small at the same time. But if you sign a non-compete, then you're like, okay, well, I can't practice in this area. I have to practice over here. And I was like, I just don't feel sold by either of these practices. So I decided to do relief for a while.
Oh.
Yeah. And that was kind of another jump. It was another leap of faith, another getting uncomfortable, doing a lot of research. How do you even do relief? And I loved it. It was really, really fun. I loved it. I did that for about 2 years. In Charleston, the surrounding areas. And that was also a really cool learning opportunity because I got to see, my only experience was Thrive in the ER. And then now I was getting to see how all these other just general practice places were running. And the drastic difference between some of them, culturally and even medically, it was so interesting to see.
Yeah.
Just a fly on the wall.
It's a huge spectrum that you probably got to just suss out and understand.
And just again, I was shocked by some of what I saw, in good ways and bad ways, but the way some practices were running versus others. And kind of just gathering knowledge of I like what this practice is doing. I want to practice that way. Or and meeting all these different doctors who are doing all these different things. And it was really eye-opening. It was a really fun experience. So another thing that, if you're ever in that situation, it wouldn't be a bad thing to try for a little while just to broaden your horizons, I don't think it's common for most vets to stick with one practice anymore. I think there is a pretty good turnover of places, but it's not common that you get to work in 30 to 40 different places, right? So the relief experience is really cool. I think it's something that if you're interested in practice ownership would be really helpful.
Yeah, because then you're like experiencing what works well, trying out different types of
what
machines.
works well, and then not just for medicine, but also again culturally, like just some of the differences that is like some practices that everyone really got along and was very respectful and worked together, and there's other ones where I was like, I'm probably not coming back here. Like this is very toxic.
I will not be picking up another shit.
And it was really entertaining in a way because you got to kind of see this drama without being involved in it, you know, because you're there for like a day and you're just like, wow, this is dysfunctional. Like, there's some crazy stuff going on, which we hear about that, right? We hear about toxic vet med and these toxic clinics, and it's sad because then, you know, right down the street there's this clinic that's like sunshine and rainbows and everyone's respectful and getting along.
Wow,
and most of the time it definitely started from the doctors and management, right? It's one of those things. From what I saw, like it trickles down most of the time. Not always.
That's been my experience usually as well.
But I think for somebody interested in practice ownership, I think relief is so huge. So I did that for a while, but then I got pregnant, right? And I was expecting my first baby, and I thought, okay, I never call out sick. I pride myself on being reliable. You know, when you're relief, you're the backup, right? Reliable. Yeah. So you have to be reliable. It's your business. You've built a business on reliability. And I was like, I don't know what being a mom's going to be like. You know, that was another leap, right? Another huge change of my life where I was like, oh my gosh, what am I doing? I have no idea what to expect. I know I'm going to put my kid in daycare and he's going to be sick and I'm going to need to stay home. And like,
life's going to happen.
Yeah. Like, and then when my son is sick, I can't just call relief and be like, sorry, I know I'm your relief doctor, but I'm not coming today because my kid is sick. Like, what do I do? So I decided, you know, that maybe it was time to hang up the hat. And relief in a way too was like basically job interviews everywhere. And I had several practices that told me that like, hey, when you're done doing relief, let us know because we love working with you and we'd love to have you. And so I reached out to a few of those clinics that I enjoyed going back to, and clinics that I know wanted a dog. Yeah, good culture, medicine. Good medicine, good location, good clients. Like I was basically getting to cherry pick, which is really nice. And so the clinic that I'm at now is actually one of those clinics. And it was founded by a man who actually did recently sell to like a corporate overhead. It's a part of a VetCor chain now. Yeah. Which for corporate, like they are very hands off. Like they really are very hands off. They don't tell us how to practice or anything like that. It's really, really nice, but they're very supportive to like whatever we want to do. But Dr. Doug Berger was the founder of this practice, and he literally saw anything. I mean, when I was doing relief there, I was like, oh, I just see dogs and cats at first.
Yeah.
Because then like on my day off, he'd call me, on his day off and I was the only one there, he'd call me and he'd be like, hey, like one of our longtime clients, she's got this chicken and this chicken is really sick. It's not getting any better. It just needs to be euthanized. And I was like, well, I trust myself to kill anything.
Yeah,
like,
I know how to perform euthanasia.
I can help anything pass peacefully. Like I have the medications. I can't mess that up, right? Like I will just overdose it with fentanyl or something, and at least it'll die peacefully, right?
You can help it die peacefully.
Yes, I can give it a little chicken ending. Even a chicken, I think chickens do deserve that. Like this poor chicken, I think it probably had like a cancer or some type of. It was older. Its belly was full of fluid, and it looked very sad. So I was like 100%. Please, like, don't make it wait till
tomorrow.
Exactly. I can not happily. But I can accommodate that, right? Yeah. And it started with stuff like that. But he really, you know, one day we were talking and I was like, oh, it's so cool that you'll see all these things. And like, how did you learn to do this? And he's like, well, I went to veterinary school. You know, he's like, you know all these things. And I was like, no, I don't know how to do any of what you're doing. I
think you're picking on me. I don't know.
But it got me curious. And then I was like, you know what? I can probably branch out to seeing like the small fluffy things. Like I could probably see a rabbit and like a guinea pig and a hamster. A lot of times with the hamsters, you know, they only live a couple of years. So most of the time when you're seeing them, it usually is more like for palliative care. I have had one person, you know, take me up on hamster surgery for like a laceration from like another hamster, like they got in a hamster war or whatever.
Oh my gosh.
But most people aren't willing to do much, you know, but you can still help. And of course, when you're looking at, you know, branching into different species, I did have to go back and be like, okay, well, let me like do some rabbit CE and some guinea pig CE and some rat CE before I actually start. Like, I don't want to, you know, first
you don't want
harm.
To show up without any context
you know,
or
first,
information.
First do no harm, like get some refreshing in. But, you know, a lot of the knowledge was there, at least the baseline to build on. The basics were there and I could build. So I started with that. And then it was like, oh, well, maybe you could see this leopard gecko. And I was like, what am I going to do with a leopard gecko? Like, I don't know anything about reptiles. Like, I don't like them. That's what I said. I was like, I don't like them. They're gross. But oh my God, now I'm obsessed with leopard geckos. They've got the cutest little hands. I know they're little, like, if anyone just wants a better day and you're listening to this right now, just Google like leopard gecko hands. Like, cause they're just so cute.
They're so cute.
They are so cute and they're so nice. And again, I was like, well, maybe I could, I started with, can you help one do something for me like this? And I would be like, sure. And then I did some CE and then I was like, okay, I can start seeing like leopard geckos and bearded dragons because we get a lot of those. And then ball pythons, why not? Sure. Now just take the legs off of it. I can keep seeing that. And then
take the legs
it was, more chickens. And then from the chickens, it was like, okay, jump to the birds. And
how long was this like development of your love for exotics?
It's like the tiptoeing around the edge of it was like a year of me being like, I don't know, maybe I'll help this one with this, or I can do this one with this, or we can do this, or like, if you walk me through it, I can do my best, and to like being full on, okay, I am seeing these exotics patients. Like that transformation took like a year to me being like, okay, I like they are my patients. Like I will see them. And then I've been doing that now for almost 3 years. And I will just say probably in the last like year to 6 months have I been more confident with some of these species because it's kind of a rodeo, a lot of these species that we see. I had a hedgehog with a cancer and I was like, cool, well, what options are there? And there's literally nothing. There's no literature.
No information. Yeah.
There's no literature about treatments that are available, or like a lot of it, you go on Vin and you're like, okay, I'm sure other hedgehogs have had this.
Yeah.
And there's people who are like, yeah, I had a hedgehog do this and we tried this and this and this. And I'm like, okay, that's something to go on.
We can try it.
Yeah. So it's kind of a wild west, or you pull out the Carpenter's formulary for exotics and the drug ranges are crazy.
Yes, that's always the most intimidating part for me about exotics. I'm like, okay, 0.5 to like 2. Great. Which one? Which number in between?
And I often, I try to err on the side of caution. So usually I'll use the lower doses and then they're still just like looking at me. And I'm like, you're supposed to be asleep. Like I gave you enough to kill a cat. Like why are you just chilling?
You're just looking at us.
Yeah, like, they're like,
yep, I've literally experienced that.
Are you waiting for something? You're like, you're supposed to be like flat out. Like,
I need to be able to touch you.
I know. So then, you give a little bit more and then you wait. And then usually like what I'll do is, and then I'll top them off with maybe some ISO or something if I still, because I'm like, I'm afraid to give you anything else. Like what is going
to happen?
Yeah. And so one of the other exotics veterinarians that I've connected with just kind of for mentorship and community, they told me, they're like, okay, with exotics patients, you have to give them, it's like just enough to get them sleepy, but just not enough to kill them. And I was like, great. Okay, great tip.
Is that one in the 0.5 to 2 range? Which number is that?
And it's so wild too, because I'll talk to all these different exotics vets, like even about pre-anesthetic medications for a rabbit.
Yeah.
Well, I'll be like, what's your protocol? I've changed my protocol like 5 or 6 times since starting this journey. Nobody is doing the same thing. Nobody. And I'm like, I just need to know how to spay a bunny safely. Like, what does everyone do? Everyone is doing something different. Like,
yes. Everybody has their own.
Oh my gosh. I've probably talked to 20 different exotics vets and they're all doing something different. And I think that's one thing that, I've learned from this is like, you just have to do what you're comfortable with and find like what works for you and then stick to it. Like, and I'm in that place now. Like, and I've just finally gotten there. Yeah. But it's really cool too. This clinic, our motto is we'll see anything that reasonably fits in the building. So I've had people bring me like the mini pigs and like pygmy goats. And I'm like, oh my gosh, my large animal life is like coming back to me. Like I need someone to get a cow in here like reasonably because it has to reasonably fit in the building.
What about the like cute little fluffy ones?
I know. No one has those here in Charleston, unfortunately. I did have someone bring me like a lamb. Unfortunately, it was really sick. So he ended up going to heaven. But I was still just like, cool. Like I got it. Like I know what to do. And like when I did the exam on the lamb, I was like, it's all back here. Like it's in my head. So, but yeah, that's kind of like the progression of like where my career has gone from me starting as this, like, I just want to see cows to me seeing like everything but cows. Like
literally everything but cows. Cows are the thing that doesn't fit in the door.
Cows and horses probably can't get in, but like anything else that fits in. Our clinic's rules are we won't see venomous snakes because I'm like, no.
Well, yeah.
And then like non-human primates because I think there's a lot of, there's a lot of diseases that are unfortunately compatible, and I'm like, I don't even know enough about where to start with that. So I don't know where they would even go. We are fortunate in Charleston there is a local exotic specialist. So
amazing.
Yeah, and then I tell people, I'm like, hey, I'm like B team, like I'm like the family medicine doctor. Like I will help you as much as I can, but if we get to a point where I can't, like I really want you to go there. And, yeah, and again, it's the same with dog and cat specialty, right? Some people just can't. You know, they're like, I understand, like I need the CT scan, but I can't afford it. And so if you can do what you can to help me and my pet reasonably, and I'm like 100%, as long as you know, like, you know, it's all that that spectrum of care.
Consent. Yeah.
100%. Yeah. And that's what the same thing that I do for dogs and cats, the same thing that we're doing, you know, is you say like, hey, I can do this much for you. And then this is what could also be done for you. Do you want to do that? Right. Because some people don't, or, you know, there's so many different barriers to why people may or may not go to see a specialist. But
I completely agree. It sounds like it's been an incredible journey.
It has.
I love that your story involves this like pivotal moment where you really needed to lean into your intuition and just be like, oh gosh, I don't see myself here.
Yeah.
And then literally running in the other direction.
Yeah. It was like an identity crisis, honestly, because I had, like I said, painted this picture of who I was going to be. And then I was like, I've always been so like, I'm not a quitter. I'm not a quitter. And I was like, is this me quitting? Like, is this me giving up? Like, who am I? Right. Like I said, there was so much that I just felt like suddenly went up and spoke and then I didn't even know who I was anymore. And, but yeah, I mean, I wouldn't change, I think a second of the journey, like any part of it, because it has been so enlightening, and every single experience that we have makes us better doctors.
I completely agree.
Which is
and
really cool.
Everything happens for a reason too. It's always building and growing you, making you stronger, more resilient, more strong.
Yeah.
Amazing. Now I want to talk a little bit more about your platform as like the Honest Vet.
Yeah.
And I love your story of why you were called to show up in a way that just is really spreading positive and truthful information to pet owners. That's huge. And as a veterinarian who was like watching you grow this platform, it was like, oh yeah, like I'm glad somebody's out there, you know, speaking up for this stuff, because we would see other versions of it in the emergency room.
Yeah.
So what do you feel like has been the hardest thing that you've had to like be honest about? Like standing true to this identity of being the honest vet and speaking up amongst things that might be misinformation out there in the pet world.
Yeah. I mean, the honest part of my name really just came from, I want people to know that like I am being honest about everything that I say. Like everything that I'm saying on this platform is honestly how I feel. And
it's honest and true to you.
And it's honest and true to me. Yep. And there's no agenda behind it. Like I'm not here to make any money.
Yeah, you're just showing up authentically.
Yeah. Like if you take my advice and you live, you know, on the other side of the world or 4 states away, there is no way that I can benefit really from that, except from not like knowing that one less pet suffered.
Yeah.
Because that's what it comes down to, is these pets don't have a voice and they don't get to choose their treatments. Like, people would say, well, he doesn't seem painful, so I'm declining the pain meds. And I'm like, but they're limping. Like, they're limping. They're in pain. Like, how do I connect these dots for you? Like, so the honest information is that your pet needs these pain meds. And yes, there are side effects of pain meds.
Of course.
Right? There are side effects or anything. But if your dog could talk, I bet you they'd say, hey, can I have the Advil, please? Or, you know, the doggy the carprofen, the doggy Advil. Because, it's nobody wants to suffer needlessly.
No.
And I'm sure there are outliers. There are people out there who are like, I would rather suffer than ever take an ibuprofen. Well, good for you. But like maybe your dog wouldn't. Right?
Yeah. I always tell the story like when I have a black cat show up in the hospital, I'm like, so you know when you're on a road trip and you're like, your partner leans over and they're like, hey, babe, the next gas station's like 20 miles away. And you're like, I can't hold it that long. You know, now imagine that by like, 24 hours. And then like, let's like make sure we get them unblocked and actually move forward with this procedure.
Yeah.
Because then it shows them the feeling. How uncomfortable it is.
Yes.
Eyes like corneal ulcers. I had a corneal ulcer last night and she was like, he doesn't seem painful. I was like, this is very painful. Think about when you get an eyelash in your eyeball.
Yes.
We have like a
just how uncomfortable that
across
is
your eyeball now. Like that is so painful.
Okay, I love that you do. I definitely do that too, where I'm like, okay, let's put ourselves in this situation, because ear infections, even, we see them all the time. And I'm like, don't you think that would hurt you? And then once you do that, I feel like people are like, oh.
Right. I think people expect
yes.
our pets to show outwardly the same signs that we do, or to speak up about it. but their intuition is just to hide it a little bit more and be a little bit
sometimes
more
that pawing at their ear or that rubbing on, like that is them showing that they're painful and it's bothering them, you know? But I love that, like putting, like, I know we're not supposed to humanize all the animals and stuff, but to some degree it is a helpful tool to be able to do.
And that's what we naturally, I don't know, like for me, that's part of why I became a veterinarian. You know, I was on my family farm hanging out with like 100 cows, and they were all my best friends because, you know, when you live on 100 acres and no one else lives around you, it's like your little sister who like sometimes you get mad at, and then like all the Angus cattle, you know, and you learn to like understand their body language and understand like the small nuances of them being happy or sad. But we can't necessarily expect, and then we go to school for it, right? So we can't expect necessarily our pet parents to know all those tiny nuances.
Another story I'll share with pet parents sometimes about pain is that one night at the ER in Austin, we had animal control bring in a dog, and he was a pretty muscly pitty mix. He was so happy to be in the ER. He was wagging his whole body like as vigorously as he could. But here's what was fun about him is he clearly had a very obvious femoral fracture in his like right back leg. So he's wagging his whole body so enthusiastically. He's like, oh my God, I love you guys. Like, people are the best. And his leg is like doing this. And I'm like, you're hurting yourself. Like, there is no way in high heaven that is not painful. That you could not convince me in a million years that this dog's big, swollen, bruised leg that was flailing around as he wagged his tail. And it was clearly a fresh break. Like, I think the guy said that they had seen this dog get hit by a car or something. And then like a good Samaritan called him, and then he caught the dog, and he said the dog was easy to catch because he was like, I love you guys. Like,
and you're like, oh my God, your leg is broken.
Yes. And that, him just being so happy to be around people that he like was able to just like live through this pain, and because that's how dogs are programmed.
Yeah.
And it's different, right? But I'm like, oh my God, I would be like writhing in pain on the floor, and I would not be so happy to see anybody like that. I would be willing to shake my body to make my leg move. But this poor dog
would be laying flat.
Yeah, was just happy to have like people showing him love and attention. He was clearly a stray, and so yeah, we definitely got him some pain meds and knocked him out so he would stop hurting himself. And then I think, you know, being his stray, he probably got his leg amputated. But I'm like, okay, if that dog wasn't showing pain, like they have such high pain thresholds for expressing it.
Yes.
Not necessarily feeling it. And I think that's the confusion is people are like, oh, they have a high pain tolerance, so they don't feel it. I'm like, No.
They do feel it.
They feel it. They're not expressing it because that's been bred into them. But yeah, like you just can't forget stuff like that. Again, stuff you see.
It's like helping them understand what the pet experiences on their side.
When I started the account and I called myself the Honest Vet, again, it wasn't necessarily like to be like, I'm the only one out here who's being honest, or I'm the honest veterinarian. It was just more like, this is my honest truth to you, like the honest information that I'm sharing with you. And part of it was, I didn't go with my first name because it's a strange one, a lot of people don't know how to say it. And
I go by Dr. Beth the Vet now because people misunderstand Weinheimer. They often think it's Weinheimer, which would be really adorable if that was actually my
I used to
last
say
name.
that in veterinary school. I don't know if I ever like told you, but I would be like, oh, it's so funny. Like,
Weinheimer. I get it.
Weinheimer.
No, I like it too. Oftentimes in the hospital, people will call me Weinheimer.
I had just gotten engaged, so I was like, well, I don't want to start this account with my maiden name and then switch to my married name because I knew I wanted to change my last name. And so I was like, well, I don't want to put my name in it. And so that was kind of why I was just toying with other ideas. And then it ultimately just came back to that, wanting to just put honest information out there about pet health and about being a veterinarian, because I feel like there's so much people don't understand about what we do either, or what we know. I mean, the amount of times people ask us, oh, like, so how long did you have to go to school for? Like, 4 years, 5.
Are you a real doctor?
Like, yeah, you're not well, you could have been a real doctor. You're like, I am though.
I am a real doctor.
But I am. So yeah, that's kind of where that name came from. And so really I try to be authentic in everything that I share and keep it true to myself. Even now, now that it's a bit more of a profitable venture, I do some sponsored campaigns and stuff, but it's still brands that I would truly recommend, like I have said no to some very beautiful, attractive packages because I'm like, look, I can't put my name behind your product. I don't believe in it. I wouldn't tell my clients to spend money on it. I wouldn't spend money on it. So I'm not going to sit here and tell people to spend money on it.
I love that authenticity and just conviction that you have with it. So let's say you're mentoring a younger vet and she's trying to decide to, you know, do one thing or another, option A or option B. How would you tell her to like guide that decision of is that a yes or is that a no? Because it sounds like you have some sort of process that you lean into of like, okay, this brand is for me, this isn't for me. Yeah. And like, how do you make that judgment call?
Well, if it's a brand I've been recommending and using and I'm familiar with, then of course it's like a no-brainer. I'm like, of course I'll partner with you. Like I already recommend your product, so now I can just make a little extra money to pay off my loans and stuff by recommending your product. Like totally fine to do that. If it's a brand that I already don't recommend, then it's an automatic no. Right. Like I don't want to know what you're gonna send, you know, and I'm very polite. I never burn bridges with people who reach out, but I'm just like, hey, I'm so sorry. This is not a collaboration that I'm willing to take on at this time, but like, you know, I'll reach out in the future if things change or something like that. Because some brands have changed. I've seen some change in companies, and nothing that would make me probably like flip a switch and be like, oh, now I'll recommend you. But I'm like, okay, I'm watching you. I'm seeing how you're evolving as your journey grows. And but if it's something that I'm borderline on, I've actually spoken to a few other veterinarians about it. You know, there's a big group of veterinarians who create content on social media, and many of us are connected. It's a pretty nice community, honestly. And when newer people are joining, you know, they're like, oh my gosh, I've gotten my first like collaboration offer, and like, what do I do? Right? Because they're like, I have no idea. How do I negotiate it? Do I even take it on? And I always say, like, you know, same guidelines. Like, is this something you would recommend anyway? Because if it's not, just scrap it. Yep. Don't jeopardize. Like, you will get better offers later by staying true to yourself than you'll get by taking this offer now and like compromising your identity on it.
Don't do that.
So don't do it. Yeah. But if it's something that you've never heard about or something that seems intriguing, ask for more information. Get as much data as you can, you know, especially with supplement companies. I feel like I cannot believe the amount of supplement companies that exist is mind-blowing. And I only know because I get so many requests to work with them. And, you know, and I'm not saying that all of these supplement companies are bad, right? But I'm just saying I have very high standards for which ones I will recommend, because why would I recommend your supplement over one that I know works, right? Like, you have to be able to prove to me that it's better than the one I already like. Yeah.
Do they give you like research back information?
Yeah, they'll usually send me research they have. Sometimes they have me sign an NDA, which is right. They don't want me to take their research and give it to another supplement company, but I'll look at things, and it's not often that these supplement companies reach my standards. It's really not, you know, but I'll give them the benefit of the doubt. There was a product that came out about a year ago called Pathogen. Have you heard about it? Like the neutralizing spray.
Yeah.
And that was when I was like, this sounds like kind of gimmicky, kind of sci-fi. But when I was looking at the data, I was like, oh, this actually sounds really good. And I ended up not doing that collaboration. Just my calendar was pretty busy, but I was really intrigued by their information, and I followed them, and now I know I have quite a few clients who use it just because they're like I've been allergic to my cats my whole life, but I love them, so I
love that.
Yeah, they're like, I feed Live Clear and I use Pathogen, and I was like, oh, cool. Like, so some of these ones that reach out, I mean, they are good products, but you just have to do your due diligence and be sure. And if you're not sure, don't do it. I always say, like, if you're not sure, and if you wouldn't use it in your own pet, don't recommend it to other people's pets.
Wait.
Right.
Give more time.
Yep. Wait.
See where
exactly.
it goes.
See how the brand evolves. See what they do. I also don't like any brands that do any type of guilt-based marketing. That really burns me, right? Like, you know,
what's an example of that?
Like some of the fresh food companies, you know, where they show the dog eating like the kibble and it's black and white and the dog looks really sad. And then they're like, oh, and then if you feed this food, and then they just add color and the dog's like jumping around and you're like, oh my gosh. And I don't like that, because here's the thing is a vast majority of pet parents couldn't afford to feed that food, right?
Yeah. And they're doing their best.
And they're doing their best. So are they going to now suddenly be able to afford your food because you made them feel guilty? No. So all you achieved is making them feel like bad pet parents by feeding kibble, when they shouldn't feel any shame or guilt for doing the best that they can. And ultimately, that's only going to result in people maybe not adopting a dog, because they're like, well, I can't afford to feed it this fancy food, and I'm not going to feed it kibble because I feel guilty. So I'm not going to get a dog. So then there's another dog in the shelter without a home. That's how I look at it. Yeah. Like, I don't like any of that type of marketing. So even brands that kind of have a good product, if they do anything like that, I'm like, I don't want to put my name with your name. Yeah. I don't
do it.
What you're doing. Yeah.
So I'm curious, like, with that self-assuredness and that confidence and conviction probably comes some like truth to your own authentic values. Like at Evolve Vets, we talk a lot about identifying the things that you the principles and the values that you want to live your life by.
Yeah.
What are yours, and how do you kind of surround your work life and your home life with both of those?
So definitely one of my mantras is evidence-based everything. And it's really evolved from just life as a veterinarian to navigating my own life as a mom. Misinformation is loud, and it's often compelling and convincing.
Yeah.
Especially when somebody's very confident, they're speaking and they're using these big words and they sound like they know what they're talking about. And of course, we spoke a little bit about vaccine hesitancy rising in pet parents. And obviously I know enough about the disease and suffering and pain that these can cause pets that I was never, even going to second guess vaccinating my dog. But when you're a new mom, and you're seeing this stuff, the algorithm knows when you're pregnant. You go to look up like on Amazon, like maternity pants, and then all of a sudden like everything in your feed,
the
algorithm is like spitting you motherhood stuff. And like I said, that experience too makes me more empathetic to these people who come in who are vaccine hesitant for their pets, because I've been there as a mother, and I was like, okay, well, how can I in good conscience, preach evidence-based everything in pet med and then vaccinate my kids without at least looking and seeing if there's any truth to any of this, like what's going on. And so, yeah, I had 9 months to do research and reading, and I read, I can't even tell you how many research papers about vaccines and autism and aluminum and
wow.
Like, oh my gosh, I was very well versed there for a while. It's all faded. This is, my son's 3.5 now, but because I wanted to make the most informed decision. And like I mentioned, I tend to be very indecisive, and I ultimately, came to the same conclusion that all of, the AAP, the American Academy of Pediatrics, and everything came to, because of course they're looking at all the same research and
they read the data.
Yeah, I was like, oh, okay, I got it. There's nothing here.
There's some
like
confidence and calm that comes to you from doing the research yourself.
Yeah. Then when I showed up to the vaccine appointment, I didn't have that. Like, I didn't even look. I didn't even think. What if? I was like, nope. There's nothing here. This claim is as bogus as they say it is. It's just like people bringing their pets to us and having the same concerns. But again, I could see how easy it is. And then I also saw in my quest for knowledge, I did see some research studies that were more supportive of that argument. But that's where being a veterinarian is so amazing. It really is a superpower, because we have advanced training, not only in immunology and microbiology that can better allow me to understand these papers, but also training in reading these papers and training in data interpretation. So like a study of 8 doesn't bear nearly as much weight in my mind as a study of 800.
Right.
And I can identify confounding variables and all of those things. And so I get to take that into my life outside of being a vet and use it to bring me peace in so many other situations that I had never imagined.
Right.
Like, and the same thing came down to like sleep training. There's so much misinformation on sleep, like I had never expected. And there I was again. I'm like, all right, back to the books. Like,
back to the book. Let's
read about sleep training. Yeah. Like because I'm not an expert and I don't know. And I tell people all the time, you truly can only be an expert in one or maybe two things in your life. Like, an actual expert, a dedicated expert. One, maybe two things, maybe three if you're like a super genius or something. But, other than that, you don't have time to do all those deep dives in everything. Like I spent 9 months on one topic because I'm not an expert. So I had to.
It takes time.
Yeah, it takes a lot of time. Like that's kind of where the do your own research stuff gets a little bit misinterpreted. Like I don't want to tell anybody like, hey, you're not qualified to do your own research.
Right.
But you have to recognize your own limitations in doing your own research and understand how much research you really need to do to fully understand a topic before you can be longer in some cases. Like I probably could have kept going, but I was like, okay, I'm tired. I've gotten
the baby's
enough.
Coming.
Yeah. I've gotten enough data to make me feel much better about this decision, But yeah, it's
exciting.
I don't remember again kind of like the base question, but that's one thing that I've really that has evolved with me on this journey is my love of using research and evidence to guide all my decisions.
I love it.
If you love this podcast, you find yourself nodding along, thinking, this is exactly how I feel at work. And sometimes even outside of work. then I want to invite you to something even bigger. Come with me to the Evolve Vets membership. It's my online home and community for women in veterinary medicine who are done surviving and ready to start evolving. Inside the membership, you're going to find race-approved masterclasses, vet reset meditations, live monthly coaching with yours truly, and a community of women who actually get it. It's not toxic positivity. It's not just another membership you sign up for. It's learning how to manage your energy, protect your boundaries, and build a sustainable career in veterinary medicine. It's your choice to move from self-abandonment to self-devotion. And the truth is, you don't have to do it alone, my friend. Come evolve with us.
No, actually, I love that. The ability to choose whether or not to euthanize something is something that I think a lot of us, when we graduate, we don't realize we really get any choice. Like, the owner wants to euthanize, we got to euthanize.
Yes.
You don't have to. I've said no. I have said no.
Oh, yeah. I've said no.
I've been
so
like, hey,
many
this
times.
dog could easily be rehomed. Yep. Like, they have all these great characteristics. Like, go to the shelter, or owner surrender. Like, but we do not.
There's rescues. There's so many options.
Now there are times, 100%, where euthanasia is the best. And in those situations, we don't argue. We don't. I never. But if there is an animal that needs to be advocated for, I mean, that is our job too.
That is our oath.
Yeah,
yep, exactly.
Yeah, I've fortunately I've only had a few really off the wall euthanasia requests. I'm glad it doesn't happen.
I don't
every
get
day,
a ton,
but
but my scenario is very unique because it's in the ER.
Yeah. Oh yeah.
But I'm sure you guys see way more in the GP world.
Well, I mean, we see a lot of euthanasia,
ones.
But I mean, just like I said, off the wall, like, I had an owner bring her cat to be euthanized because it kept vomiting on the carpet like once a week. And I was like, okay, well, we can make some changes. Like, there are so many things we can do. Your cat is still a very healthy cat. Like, it, hairballs, like, it was a long-haired cat. Yeah, I was like, okay, let's, because she, in her defense, she was an older woman and she was in a wheelchair, and she's like, look, I don't think she was in a wheelchair, but she was, I can't remember, but she was limited mobility, and she's like, well, I can't keep cleaning the carpet. And I was like, okay, well, then we can rehome your cat.
Let's find a new home.
Yes, like,
let's do this together.
We can find. There's another situation. There are so many other options here, and she was like very open to them. But that is something that I think, I brought it back up, I revived it for the podcast briefly, just because if there's any other veterinarians listening, I want them to know you can say no.
Yes,
you can say no. Hey, go somewhere else, or. You can sit there and you can advocate.
It's you sleeping at night.
It's your life. It's your life, conscience. At the end of the day, you're the one who has to go home and sleep and feel good with the decisions that you made.
Completely.
Agree. And that's also comes back to like taking partnerships on social media. Like, you're the one. It's your voice. It's your life. It's your conscience. Like, you have to sleep at night. It's your brand. Yeah.
Your family that gets affected. It's 100%.
Yeah. You have to protect yourself.
I'm so curious I'm curious about your journey into leadership. As a female leader, we're now 68% female
and
veterinarians,
rising.
And then there's only 21% of us in executive level roles, which is so interesting to me. And it's always been a core of better understanding like how we help women become leaders and be good mentors for them along their journey. So people like me and you have had this amazing opportunity to become women veterinary leaders. And so first, I want to know like how you got there, and then were there any hard moments in that journey of leadership that you hit?
Yeah, so I'm the chief of staff at my clinic, and it is a smaller practice. It's just a 2-doctor practice. We have about 5 technicians, 2 receptionists, so small team. But when Dr. Doug Berger, who founded the practice, was stepping away, they needed kind of a veterinarian to lead the practice, and he was retiring, and he was moving, and they offered it to me, and I was like, oh, of course, I'd love to be a leader. That sounds great. I was so gung-ho about it. I was so excited because, you mentioned I tend to be very enthusiastic, and
yes,
I was always the bossy child, and I've never had a problem asserting myself, right? I've always been like, we're going to fix it. We're going to do it. We're going to, like the cheerleader kind of personality.
Generator energy is what it feels like.
I never realized that also could be a weakness in some situations. But so I stepped into this role, and I thought it was going to be rainbows and butterflies, and it was immediately hit with some kind of like stagnatism, basically, or like reluctance to change, right? So I'm like, I'm the leader now. There's so many things we can do to improve this place. Like,
I've been waiting for this moment.
Yes, I've been waiting for this moment. And then there was a lot of like, well, we don't need to do that actually the system's been working just fine, and being like, but here's what it could be better, and all those things. So that was actually kind of my first, stepping into leadership and immediately kind of being like hamstringed a little bit by this reluctance to change, which I think is just very common. I think that's going to happen anywhere you go or anything you do, especially when you're taking over a team that was established and running under someone else for a long time and it was doing fine.
Yeah.
But I was able to really push for some changes. And then when the team saw that those went well, they were like, okay. Like I had to kind of prove myself a little bit.
Small wins.
Small wins. Yeah. Yes. Like little things I really had to fight for. And then once they were like, oh, actually, this is working so much better. Okay, I'm glad we did this. So this, and then you kind of win that trust and build that trust. It definitely wasn't easy, and it took months. I mean, I've been in that position now for 2.5 years, and now it's very different than it was when I first started.
What was your evolution through that?
Yeah, so really learning to lead a group of people and learning that you need to understand each person individually. That was something that I hadn't really thought about, because I'm like, okay, you're just a leader, you're going to do the same things, but you can't lead each person the same way, especially in one-on-one conversations. How I approach my feedback with one person is very different to how I'm going to approach it with somebody else. And, it helps that I know these people well. We work together every day, but it's something that you kind of have to, again, learn. You can't just, and there's trial and error to this, I've definitely had some conversations and walked away, and often I'm like, oh, I could have said that so much better, or I should have said this, or I hope they don't hate me. That was something I really struggled with taking over the thing, is because I did feel that I had a rapport and a friendship with the people that I worked with. We all got along really well, and I kept thinking, oh my God, I'm going to ruin it because I have to say this thing that I know they don't want to hear, and I want to have to ask them to do something that they're doing. I need them to do it differently.
Right. And what does giving feedback to your team feel like in those moments?
No, it really was more anxiety inducing than I had anticipated.
Yeah.
Because it's one thing to like be a leader and like make the plan and then like, lead the team through the plan, but it's a different thing to have to address people and give negative feedback. And that was something that I hadn't really ever had to do before. And nobody really told me how to do it. And
it's definitely not something covered in vet school.
No.
And it's something that we commonly see with women in our membership too. It's this challenge, and the people that I coach, it's this challenge of wanting to be liked and wanting to do it well. And also like almost a layer of avoidance around 100%. It, because we do want to preserve those relationships, and usually their intentions are all very good. But it is something that needs to be done, and it does come with a lot of emotions and feelings on the other side too, after you give the conversation.
Oh, yes. Yeah. I mean, again, then you're like, oh my God, I could have said this, or do they hate me now? Or did I ruin everything? So my older brother is actually a major in the Army now, which is pretty cool. And he and I talk pretty regularly, and I was sharing with him some of these challenges, and he's like, oh, I have to send you a book. I'm going to send you a book, and it's really going to help.
I love that. What book?
Yes. It's called How to Win Friends and Influence People. And it has been in print for almost 100 years now. It was written in like 1938.
I love that book.
You read it?
I've read it.
Right?
Like 6 times.
Yes. I actually
So good.
reread it every few years. Not just because it is so simply profound. You're like, this is so easy and it makes so much sense. But also it's actually entertaining. Really, it's an easy read. It's short. And even though it was written 100 almost years ago, it's
still
resonates.
True.
Everything is still true. And basically, it's just like how to have a conversation with somebody and give them feedback and get them to see your side. And not only has it helped me in those situations, but even on social media or even in the exam room when I'm in a sticky situation with clients. So when I'm doing any type of communication CE, because that's another avenue I've blossomed down, is I like to talk, and I cannot stress to other veterinarians just how important it is to be able to communicate with pet parents and to have a variety of communication tools in your toolbox. But that is a book that I recommend on almost every lecture, because I'm like, if you get nothing else from me but that you should read this book, like
read it.
It's like $8 on Amazon, and it takes you maybe a week to read it, even if you're not a big reader, because it's
a classic too.
It's a classic. My version is like falling apart and everything's like underlined, and and whenever I'm struggling, we had a change in management at our practice less than a year ago. It was probably like 8 or 9 months ago, and there was some conflict with the new manager with all of us, it wasn't just her and some of the techs or her and some of the doctors. It was kind of just like a uniform, like, we need to reevaluate your leadership style. And I had to have that conversation with her. And then I also, gave her the book because I was like, hey, like, you need to maybe,
there,
like and it was a hard conversation to have, being like, hey, your leadership skills or structures and types aren't necessarily matching this clinic. Yeah. So here's something you can do to help. And ultimately, I don't know that she read the book. She never did answer me or not. But she ended up leaving, and now she's at a different practice, and apparently she's doing very well there. And we have a different manager who's doing great. So sometimes it's just not the right fit, and that's fine. But if you don't have that hard conversation, then they don't know that they're maybe not a good fit. And then again, it can fester. And so with experience, I have learned that it is as daunting as it can be. And sometimes I lay awake the night before these conversations, like trying to perfect what I'm going to say. And then I don't end up even saying that, which is so frustrating. Yeah, so annoying.
Same. Like, I literally had this all planned.
Yeah. Like, I planned it out. Nothing goes that way. It usually goes just fine. I made it a much bigger monster than I needed to be, but I have learned that it's better to just do it when you need to do it. Like, do it at the first time, the first time it happens. Don't wait for it to become a thing that's happening all the time, or don't wait for it to trickle through the team, or don't wait for the resentment to build between the doctor and the tech, or the techs and the techs, or the manager and whoever it may be. It's better if you just nip it in the bud. As hard as that can be to do, that's one of the things that you just learn through trial and error as well. Is like, it's just so much better to have that hard conversation.
I completely agree. The sooner you give the feedback, the better it goes. And I think there's usually a fear around it affecting relationships and diminishing them, which is a completely normal fear. But the truth is, like, the people that love you are going to see that as an opportunity for them to grow. Yeah. And you can even say that in the conversation. Yeah, I love and care about you. Yeah. And I see a version of you that is reaching this vision that you've told me about. Yeah. And I believe that you can get there. And I want to support you to get there. And in order to get there, we really need to focus on, how you're communicating with the team. And let me help provide you some tools, just like you did with the book, to get you there. Yeah. And I want to be your accountability buddy. Let's have a conversation about this and slowly work towards, where you want to go, because this is your life and your career. And we want you to stay in veterinary medicine, and we want you to do it for all of your life.
We don't want to lose anybody. We want you to love this job. Yes. We don't want you to leave. We don't want you to never be in vet med again or give it up, because that happens. Especially, I was mentioning before, there are a lot of toxic clinics, and maybe unfortunately that's your only experience with veterinary medicine. Of course, you're going to think it's super toxic, so you have to try other things. So we never want anyone to be pushed out.
All right. So Sylvalyn, do you have any advice? Let's say the young female, either aspiring veterinarian or, we believe that all vets are leaders here. So, if you could give them one piece of advice, like, what would it be in, helping set them up for success?
Yeah, my biggest piece of advice would be to stay flexible, listening to that inner voice inside of you and letting the journey kind of, going on the journey, as opposed to being so focused on the destination. Like, you might have a destination in mind, whether it's practice ownership or medical director or something like that, but don't be so focused on that you miss the journey, or that you miss maybe different forks in the road that you could take that might take you somewhere that you absolutely love. It's so easy for us as type A perfectionist veterinarians to be so focused on the end goal that we don't enjoy the process, or that we miss something that could have been amazing along the way. So I just think my story that I've shared is such a good example of that, is that you never know where this field can take you. And leaving this field is definitely the last option. If you're ever feeling burnt out, you can do what I did, where you can recognize that, you can take a step back, and you can completely change how you're practicing. Going from, full-time GP and ER relief to just doing GP relief was just a huge shift, and was what I needed. And so being a veterinarian, it's truly a superpower. We have the coolest job. People make TV shows about us. They write books about what we're doing. Our jobs are fascinating. And so just remembering that we have so many different avenues that we can take, and that if you change your path, it is not quitting. It doesn't mean that you gave up. You've just found a different calling, or even if it's just temporarily.
Yeah.
Yeah.
And there's so many diverse ways that you can show up as a veterinarian.
Yeah.
You can go into industry,
Yeah.
like food, One Health, like conservation. There's so many different types. It doesn't have to, the answer doesn't have to be escape the profession to find that peace and clarity. And for some people it is, and that's okay. But really, is there moments where you can reconnect with yourself, reconnect with the people around you, find community?
Yeah.
So that way that this is something that's sustainable.
100%.
And pivoting in small ways, do it. Everyone does that a little bit. I just took this new job 6 months ago, and it's been really exhilarating to get back into medicine in a different way and from a different perspective. And it's probably the same thing with you and exotics, right? You can still love veterinary medicine and pivot in small ways.
Yeah, absolutely. There's so many different ways that you can renew your joy for the profession, no matter what it is. Even if it does mean maybe stopping temporarily and doing something completely different. But yeah, it's
we love you and come back.
Yeah. Don't leave us.
I love it. Well, how can people get in contact with you?
Yeah, so I'm mainly on Instagram as The Honest Vet, but you can find me there on TikTok and YouTube as well. And just feel free to DM me if you ever have questions or just need to connect with someone. I'm always happy to speak to fellow veterinarians. And I say all the time, when one of us wins, we all win. It's a small community, but we need to stick together and we need to support each other and raise each other up. And that's what I'm here to do. And if I could ever do that for you, I'd love to. So if you need me, reach out to me.
Yes, please. Thank you. Sylvalyn, it was so fun hearing about all your stories and just really getting to go back down memory lane also was very fun. And just giving this extra layer of what it's like to be a leader, to be a mom, and to also show up in ways that, having a public platform and being a voice for pet parents everywhere. It's a very special and unique journey that you've had, and just honored to learn a little bit more about it and kind of peer under the hood a little bit. So thank you so much for
to share
here
with you guys.
Okay, so together, let's stop revolving and start evolving. Thanks for coming. Thank you so much for listening to the Evolve Vets podcast. It truly means the world to me. If this episode supported you or sparked something new in you, please go to evolvevets.com to become a member or join our coaching program and truly continue this work beyond the podcast. Let's evolve together.